Hello, everybody. Good afternoon. Thank you for attending our webinar on the specific health needs of persons with disabilities in the context of the coronavirus pandemic. My name is Renaud Schoer from EASPD. I would just like to share a few practical details before we start. Firstly, the webinar is being recorded and it can be published afterwards. Secondly, as you can see, we have a lot of attendees today, so all your microphones have been muted, aside from the speakers. But throughout the webinar, you can ask questions if you want by using the Q&A button at the bottom of your screen. We will look at these questions, and then in the last 15 minutes of the webinar, we will go through a few of them if we have time. And finally, we have not been able to arrange for real-time captioning today, but we will work on accessibility for the following webinars that we are going to host. So thank you all for being here. I hope that the panel is going to be very interesting. And now Luc Zelderlo, EASPD Secretary General, will introduce the topic for us. Thank you. Luc?
Thank you very much, Renaud, for setting up this webinar. Dear friends and colleagues, welcome at this webinar. As you might see at the bottom of the screen, we are already with 130 participants, and that is proving that indeed there are very important needs, questions, requests in the field. And through this webinar, we will try to respond to these questions and requests from the EASPD members, but also from other service providers. Just for your information, this is the first webinar, but not the last one. We will try to organize a webinar around very specific issues week after week throughout this corona crisis. And most probably next week, Wednesday, we will invite you to take part in another webinar that then will look at staffing issues, the problems that the professionals have to deal with in this very difficult time. And indeed, dear colleagues, we are in an exceptional time now. Our professional and our personal relations are under high pressure. Our societies, communities are in a sort of a crisis. So this is the moment to support each other and to make sure that we are supporting those that do the real work at the moment in the health centers, in the hospitals, but also in the services for persons with disabilities, in the rehabilitation centers, in the social economy enterprises, those that try to keep the support, the essential support services open and running. We should try to support them. Let's try to make sure that nobody is left behind during this crisis. And this is, I think, our ambition as EASPD. We indeed would like to make sure that persons with a disability, also in these difficult times, receive the support that they need to be able to live a decent life. This webinar and also the Facebook page that we have set up has in fact a threefold ambition. We should try to learn from each other. We should try to inspire each other to indeed do the right thing. And we also should make sure that we support each other in these very challenging times. Today we focus on medical issues. I would like to thank the speakers that made themselves available to bring a contribution today. I asked them to stick to the time so that there is also some place and some time for interaction and for questions. And let's immediately dive into the topic by handing over the floor to a good friend and a top expert, Dr. Matilde Leonardi from Italy. Matilde, is it okay for you to open this webinar by bringing your perspective on things?
Yes, thank you very much, Luc, and thank you to all the friends from all over the world that are online and that are listening to us. I am speaking from Milano, from Italy, which is now, as you know, one of the countries at the center of the coronavirus crisis. And we are facing several issues. And I would like very briefly to listen them and share them with you. I am a neurologist. I am a director of a center for patients with disorder of consciousness. And so I'm also working with people with disability in my country, particularly following the people with intellectual disability. Two things. The first is that the situation that we are facing is quite exceptional. And so it is normal that there is a level of stress and anxiety that we have not known before. And I would say that for the general population, the level of anxiety and stress can have also some fears. Let me just very briefly listen them because you might feel them or have them. The first is that people are feared to get sick, to have this invisible virus coming and attaching. The second is that people might have fear to die. Also, people might be afraid to be sick and to need to go to the hospital because hospital might have the sort of emergency pool of people that have the virus. But there are other kind of fears that we have to share. Fear to be stigmatized, fear to be isolated, fear to be excluded. And this is also, in a sense, responsibility of the communication that is overwhelming all of us and is also creating some issues. The kind of communication is that people that are old, people that have more diseases, people that have certain kind of origins, they are at risk, and not only they are more at risk, but they are those who die. And this is the message that is going through the mass media. Didn't play so much well their role in some countries because they sort of created a stigmatized environment for this. And this is creating anxiety also for another reason. You feel impotent, you feel afraid to be separated by those that you love, and the fear of loneliness. This is something that is more than any other fear present in the population. All of these fears are equally affecting people with disability and people without disability. But for those who are already having a presence of a health condition and a disability, I think that there are some fears that we have to face and we can face together with some suggestions. These are suggestions that we also share with the National Association for People with Disability, Intellectual Disability, and I want to share them with you because they have been also released to support all the members of the National Society for People with Disability. So first, the need for information. Everybody has the right to be informed, but you have to be careful. For example, if you are a person with disability or you're working with a person with disability, particularly with intellectual disability, too many information make people sick. So try, in a sense, to avoid the overwhelming of information and also try to provide the correct information. In Italy, and I'm suggesting this for people from other languages, for example, the National Society for People with Intellectual Disability provided a leaflet with augmented communication tool so that everybody could understand what's going on, because communication might not be easy, might not be simple for everybody. So communication is important. People have to understand on the basis of their age and their ability to understand the right to have good information. It is something that should be provided to everybody. Second, information should be reliable. And that is also something that those of you who have association or handling organization, you could be those who provide correct information. You could become reliable for your people. You should have to be reliable for your people. So there is a duty of those who have taken care of others to provide reliable and correct information. This information should concern, first of all, the basic on hygiene and other measures that should protect people. And the first one concerns the distancing of people, because the virus is a very easy way to transmit, and distancing has been shown. WHO is recommended this distancing, and so not having crowd of people. Of course, for those of you who are having daycare centers or others, this is really complex. And the situation in Italy now is very tough, because many daycare centers, because of this first recommendation not to group people, they closed. And this is a number one issue. You have to think then alternative way. Maybe Fabrizio will tell you more because he's living the situation in his center. But the hygienic information is wash the hands. You have to make everybody aware that you need to wash your hands very clearly. And the indication that we have from WHO is to wear the mask. And what if you don't have masks in your country? So there may be some recommendation to make them, but wearing the small masks to protect when you breathe, it is also another recommendation that is provided. And the third is, if you can avoid to move around, to go around, because people that are also in contact with virus, they can widespread even if they still don't have symptoms. So that is one issue. And I think that what we see is that the kind of drastic measures that have been taken in Asia by our colleagues from Taiwan, Singapore, and China paved the way. They were already aware of the situation because of the previous epidemics of SARS, the other epidemics that made them aware of this. So they knew that washing hands, isolation, not going too much into groups helps. The second, you need to help people to have information about this. You should find a manner for which all levels of information are provided to your people. Another thing is that if you have a center, how can you provide a daily routine to people? For many people that have intellectual disability, for example, the complete change in the daily routine could be a real disaster. And this is clear, and in this sense, you provide good information not every time in the day. You can decide when to provide information. You provide the hygienic information and you try to make people to stick to this information. And I know it is difficult for those, for example...
Okay, missing out Charita.
Zulka, please, Matilde is still speaking.
So concerning information, for example, if you cough or if you sneeze, you have to use your elbow to protect yourself. You have to give this basic information. Of course, for those who are not independent or who are already unable to do this, the kind of security that is requested is becoming a great burden to family. We are requesting people to stay home and to keep people with severe disability, with severe problems to be at risk at home. This requires from the services to reorganize, adopting measures, for example, of telemedicine and teleconsulting. And this is something that we have recommended also as Society of Rehabilitation. You cannot do the rehabilitation as it is done in person by person, but for the security of the workers and for the continuity of the care, you can reorganize services even from home so that each professional is taking care of a group of people. And this, we have examples of these kind of experiences. Never let anybody to feel alone. This is the kind of thing that we have to fight. And employment in time of coronavirus requires big action. Some of them we can try to handle through our means. Others will require governmental decisions. And I think EASPD can help all of us to stay connected. And so to have, as Luke Zeldenlo said, we might have some specific webinar for how to handle within the professional. But I would say information and clear information for all levels of understanding, keeping the basic security and hygienic things done. And you have to be sure that everybody is doing it. Maintaining the routine. Even if you are at home and you are constrained at home, You have to give yourself a routine. You wake up in the morning, you do your breakfast, you wash, you dress, and you try to give yourself a routine. And you don't stay every day just doing nothing. It might be a marathon. This is not an epidemic that is going to be quick. You need to prepare yourself to be resilient. And this is something that we can all share together. Luckily, we're living in the time of communication. Like today, we are now more than 160 people all together. This allows also to organize yourself. Communication then, and that's I'm closing, is also important. Keep people in touch. So for example, if you're dealing for people with intellectual disability, how can they be connected with others? Through phone, through Skype, use all the means, through Teams, to WhatsApp, to Facebook, all the means that are available to make people connected. And also try to be sure that people feel that they are not isolated through any mean of communication. If you are an operator and a professional dealing with other people, communication will be one of the things that you have to be aware you should keep and maintain. So establish also a routine of communication. I don't know, daily or every 2 days you have an appointment. Create appointments. Create a routine in the appointments. And I would say that as a start, as an input that we have for now, I would stop here and we can sort of continue, but I'm sure that my colleagues can add more and we can share experience. And I have one last thing to say. We are less alone than we think. If you are afraid, ask. If you have fear, share it. We are all afraid. We are all in fear. And discovering that we are all fragile, it is something that the community of people with disability knows very well. Fragility is the strength of human being. And I think that this message is what we can share together. We are all fragile. And nothing on us without us is not just a wording. It's stay together, work together, and fragility of human being is also part of our strength. So we're all dependent, one to each other. And I think this is what we're learning.
Renaud, can you take over, please? Thank you very much, Mathilde.
Mathilde, thank you for the speech. I think indeed that communication is one of the key priorities for the next few weeks. This is why it's going to be a key element of our next webinar. But first, Vasilika, I think you are connected. Can you speak so we can see if your microphone is working?
Hello from Macedonia. Can you hear me?
Yeah, we can hear you. Thank you.
Okay. Sorry, I had some technical problems to connect myself to this meeting, but I hope that everything is now okay and everybody can hear me. So first of all, I would like to share my experience with this virus. My name is Vasilka Dimoska. I'm a doctor by profession, and I am Secretary General of the National Umbrella Association for Support of Persons with Intellectual Disability in the Republic North of Macedonia. We are a service provider, and we are providing social services. This is very important to be emphasized in this situation. As I have started, I would like first of all to share my experience of self-isolation, taking in consideration that I have been in Brussels last week, and I have I come back on 8th of March in my country. Next day, when on 9th of March, actually, I have been faced with the serious situation of the virus in my country. Serious situation in order of prevention of the contaminous disease. And there were few cases of recommended self-isolation for passengers, Macedonians, who arrived from different countries from Europe. And then I have decided I have to self-isolate to protect other colleagues in my office. But on 10th of March, the government has announced the situation that lockdown of the kindergartens, schools, university, and also day services for people with children and people with disability. The positive thing in this situation for people, users of our services, was that with no limitation of age, at least one parent for children and also adults with disability who use services, day centers as a service, at least one parent should be free of from work. So that was a good point for our parents also, but it was a new situation, and we had to find a way how to make a communication with all of them. So I'm working from home, and all of my colleagues also, and we had a few days time to restructure our work and to work from the home. So personally, I experiencing isolation. It is not a good for mental health and mental function of every person. So including me, I'm in self-isolation. But the positive is that my creativity and creativity of my colleagues is increasing now in this new situation. So we have established, we are in permanent contact with families of our clients and also with the clients by themselves. And we made some kind of groups using Facebook Messenger, so they can be in touch by themselves. We were working individually online by telephone, using again this social media, Facebook, using camera video call. And we were explaining in the first few days why they should stay at home, all the measures for protection, and then they were happy that now they are connected in video communication with their friends from the services. By the time we realized that the parents, they need support. Okay, they are at home, but they need support because in the last 10 years or more, most of them were happy that we are working with their children on different skills for independent living. Now they are in permanent contact for when they are faced with some crisis or some situation at home with their child. So they are in permanent contact with us in order to manage the whole situation. So it is really a situation that every day we are learning some new skills, and we are introducing some news and new skills in communication, mostly in communication. On the other hand, all the public institutions are well organized. So maybe we are lucky that we are a small country with 2 million inhabitants, citizens. But I think that the Ministry of Health, following the instructions of WHO, but also Italian model, they were in permanent contact with Italian colleagues, and they start with prevention very early. Only today, after 10 days of rigorous prevention measures, today the government announced state of emergency. And maybe because of early prevention measures, the status, the current situation with the coronavirus is 35 diagnosed people. The first patient that was in hospital yesterday was released home, and we do not have dead cases. Only the teams of Red Cross should.
Excuse me, as we're running a little late on our program, so could you maybe use the next 2 minutes to come to your conclusions?
I will finish now.
Okay, no problem. Thank you.
So, in this situation, in my point of view, as a doctor also, we should respect the rules. We should follow the rules of WHO, and we should communicate, but on safe way. And we should use all those measures for prevention, like of course washing hands and taking distance if we are going to use in public. And we have to be conscious that this is a really serious situation. And I have to be honest today that I was very surprised the day on Monday when EASPD canceled the board meeting in Brussels, taking in consideration the importance of this meeting. And when I saw the mail that EASPD is canceling our meeting and the event on 8th of April, on 7th of April, I realized that the situation is serious. Moreover, when the WHO announced the pandemic, then I was really prepared to act in this situation. So for now, all the teams that are involved in delivery of the home delivery of the food, trained by Red Cross, official volunteers of Red Cross. So all of us, we are working on decreasing the panic in the population. The psychiatric clinic put online telephones for consultations. So that is for now. And I really appreciate this opportunity that we can be connected.
Okay.
And to share our experience and our point of view relating the situation in our country or professional point of view.
Yes. Thank you, Vasilka. Thank you. That was
thank you again.
Very interesting. Before we move on to the next speaker, I would like to draw your attention to the chat that you can see in the bottom right corner of the window. Many of our participants have been sharing questions, useful links, or even just kind words of encouragement in these uncertain times. When you send a message in the chat, make sure that you click in the window that you click all panelists and attendees so that everyone can see what you would like to share with us. And now we will move on to our third speaker, Alice Kippers from the Netherlands. And I think we will all benefit from her interdisciplinary approach. Alice, thank you.
Yes. Hello, here I am. Thank you everyone for being able to share some of the ideas that we have from the Netherlands. Not only from the Netherlands, but I also have asked some colleagues around the world. For your information, I'm also the Vice President for Europe of the EASPD, and EASPD is the International Association on the Scientific Study for intellectual and developmental disability. So I have prepared a slide, and some of the points I would like to share with you will be addressed on the slide as well. And I hope, because I do this for the first time, that I'm be able to share this in a good way with you. That means that here we are. Is it visible for you now or not?
Yes.
Somebody, okay, thank you. So I would like to address, because some of the other colleagues speaking before, Fazilka and Matilda, have already addressed a few points of interest that on health needs. So I would like to focus on the environmental factors and the personal factors that are in place in health conditions for people with disabilities. And I think both of them are important. To start with the environmental factors, it's already said by Matilda, the importance of accessible information. And I think in your countries and from umbrella organizations of service providers, it's crucial to create awareness at public health organizations, the media and local governments to use as accessible information as possible, because that will reduce not only the risk of giving wrong information, but also it will be as inclusive as possible. And this is already shared, like Luc said, the various information that's available throughout a few countries and languages in Europe. And also the sign language, together with news bulletins. For instance, in the Netherlands, there was really a pressure group of deaf people that made it possible that now every formal news bulletin is sign interpreted at the moment. So I think that's another very practical thing that can be organized. Also, another point of interest is that as an umbrella organization of service providers, or as a rather big service provider, it's important to have a hotline for people with disabilities, disability services and families, because information is very hard needed. So it's not only, of course, it's important to have the possibility to exchange, but also the very fact that there is a dedicated hotline will be very helpful for many people. And what we have seen throughout our group in the social media, we already have seen that it is crucial to have social media nowadays, that we can exchange information very fast. But also we have seen that people with disabilities are quite vulnerable on these platforms. We know that from other research, but there are people being othered, being discriminated at the moment. So of course it's true. It's a fact that the coronavirus is more likely to harm chronically ill and elderly, but in the same time, it is excluding people and feel them like burdens to a healthy society. And I think we must be aware of that this is even infecting, this way of thinking, our staff. So I think it's important to have them, the staff and all of us, as inclusive as possible, also in crisis time. And I would like to continue with the very nice, what I see at least happening at social media platforms is of course the positive things as well as it comes to solidarity. Many initiatives to provide shelter and food for vulnerable people, local or neighborhood initiatives, very important. And I think in this respect, it is crucial to ensure also needs of people with disabilities who are self-supporting. There are many people who are very lonely. Matilda already addressed that point. And if we are aware of that, maybe if we all of us live in certain neighborhoods and can possibly, if that is not already happening, but yeah, try to have people together and make groups of people that can chat or whatever via social media or other means to let people who are self-supporting feel less lonely. Then to the staff capacity and expansion of workforce, I think it is in our sector also crucial, because in the Netherlands we are a little bit behind from Italy and other parts in Europe. But we have an outbreak at the moment in our country, so it's rising, and some organizations are already anticipating on the increase that is needed in staff and expansion of the workforce. And I'm sure there will be a next seminar on this, but think ahead and think out of the box. And it's already mentioned, but digital forms of support who are in their child phase at the moment, I know a few, but I think that in this crisis we can do we can expand that as well. Okay, so I would like to end with some personal factors, factors that are associated with people with disabilities. Of course, the vulnerability in health, but also we must not forget that many people with disabilities are in bad health for all of their life, throughout their whole life. So some of them said to us, and I think that is a good lesson, vice versa, and maybe that can combat fear that is brought up, or anxiety in society as well. Let this be a lesson in empathy, said a person with disability. For you, it's an outbreak. For the elderly and chronically ill, it's just a day in the life. So that is, I think that is also a message to all of us, healthy or less healthy, disabled or non-disabled. And I like to stress that as well. And of course, we need to address social isolation. I already mentioned that because people are more prone to that, but also in group homes, while staying at home for all day without daily activities and disruption of daily routines, there is a risk of more violence, neglect, or abuse. And also this is important to be aware of. And finally, I think it's important to support families who are caring for vulnerable people, including people with profound disabilities and challenging behavior. And I would like to end with a very sad story from China, where a father of a 16-year-old boy was in quarantine, and he has died from starvation. And I think this is a sad story, and we can avoid this by taking care of each other in a good way. And finally, there was a very, very good initiative yesterday in the Netherlands to have a round of applause at 8 o'clock in the evening, a round of applause for all the support workers in our sector. And I would like all of us to join me now in giving an applause for all of our support workers, as long as you can. Thank you.
Thank you.
Thank you, Alice. I think that these are important things to say, and because some people, I think, need to hear it right now. Some of the other elements that you have mentioned, I think, will serve as a very interesting basis for the webinar that we have planned for next Wednesday. Alice, would you agree that we share the PowerPoint that you had prepared today with the participants of the webinar? Yes. Okay, so now we will move to our final speaker of the day, Fabrizio from Rome. How are things in Italy, Fabrizio?
Hello to everybody. Yeah, I'm Fabrizio Fei. I'm calling from Italy. Apart from being Vice President of EASPD, I also am the Director of a Rehabilitation Center for persons with disabilities. We faced since the beginning that something was happening very hard and very dangerous, quite severe. So what I will tell you is what we have done in my center for persons with intellectual and also physical disabilities, to have a bit the idea how to move and in which way we can support people, as it has been already said, because it's something that we want to do, and we don't want to leave anybody back, even in such an incredible situation. And a situation in which we didn't have any idea of what was happening, also because, I mean, it's the first time, so nothing to do with something concrete like experience from the past. In no way in our mission it was written, if we have a pandemic, we will do this or that, because of course we didn't expect it. So the first thing that I have done almost a little bit before the end of February was to write to all the families of the people who are clients in my services to take a bit care if they would have had cough or flu or fever, because it could be something different than just a simple flu, exactly. After that, everything ran very, very fast. So it was impossible just to wait that something could happen different or more severely. So we started reading, because it started arriving all the decrees from the government and from the region. Both were always underlining that we couldn't leave people by themselves, but we had to stay together with them, taking care of them, both physiotherapy or persons with intellectual disability, what we do have in my service, and also persons with neurological diseases. We treat them as an outpatient, and no of them could be left behind. But on the same time, on the other hand, the problem was that we had very strict rules to follow to, again, in a hygiene point of view, like it has been said several times, wash your hands, keep a distant 1 meter at least, and whatever, no crowd and so on. But one was contradicting the other. We tried to follow more to keep people, to treat people, but at the end this was not possible anymore. So with the last decrees, we stopped doing it, but we still was keeping open our centers, because we tried to do as much as possible any kind of, let's say, activities with persons with intellectual disabilities. That's one of my departments. We have 80 clients. And on the other hand, with the physiotherapists and with speech problems of children, of little children, just to make what we call exercises without contact with the patient, with the user. So this could be done, but day by day we were receiving medical papers saying that the client has to stay home because it was in a dangerous, fragile situation. So day by day, we reduced the number of our clients in all the departments. Nowadays, what we have to do, what are we going to do? Because now we have to face, let's say, an empty center with no clients anymore. So we realized that the main opportunity we had was to use our technology, as Vasilka said already before. So what I have done, together with my president and with my other doctors, we divided the whole clients in different groups, and before doing that also with the professionals, so that I had a group of professionals for physiotherapists, a group for semi-residential persons with intellectual disabilities, a group for the neurological, and so on. And I set up groups in WhatsApp, because that was the most easy way to keep in contact immediately, not waiting which time can we meet or whatever. So immediately these groups, I am of course in all the groups, so I can follow everything. Then with the computer, we organized the video conferences with Zoom, exactly as we are now in this moment, again with different groups, and with making meetings every day. We can share what is the best to do for our clients. In the same time, my coordinators kept in contact with the clients. We know exactly how technological or not they are. And in this way, we have daily contacts, exactly the same number of contacts that the project obliges us under a legal point of view to be paid, because of course that is one of the problems, to be paid because my people is working, my staff is working daily. So again, we give a high support both to the clients and to the families in this hard period that of course we don't know where the end will be, but in this moment it has been decided by my government the deadline is April the 3rd, but I'm sure that unfortunately we will go on till maybe the end of April at least. So we try to do our best to keep in contact and to keep in touch with our clients. In the same time, another thing that I have done, and I hope that it will be respected by my people, I put in quarantine all my physiotherapists. In this way, I will keep them home for 14 days before trying to go back to the houses, to the home, because we have home support also for physiotherapists and neurological diseases. Before doing that, I'm trying to guarantee, under my point of view, that my people will be safe. And of course, going then at home with a dress particular, with mask, and with glasses also, because every part of the body has to take care under that point of view. So this is what we are, what I'm doing in my center. I see that we have a very good feedback from our clients. My people is working very well. I'm very satisfied because really I gave them the opportunity to be professional, to work, and not just to be at home, because of course it's hugely important, as it has been said by my previous colleagues, the main support that we can give to the people, but in the same time I cannot forget that I have 80 people working as support, and of course I cannot leave them behind as well, because our professional has to be kept the most high level possible. Otherwise we feel that we are all unemployed, that we are not doing anything, because to stay at home, just at home, it's not a lucky situation, as we all know, under a professional point of view. I go to my center 3 times per week anyhow, because my secretary is still open, and of course I am there with them. And according to what Alice said, every afternoon at 6 o'clock, all the windows of Italy are open. Sorry for that. And we try to support all we are doing, and of course our doctors, our nurses, but also for us to feel alive. That's it for the moment. Thank you.
Thank you, Fabrizio. I think that's a very powerful message here, and I think that it's One of the reasons why we are doing webinars like this, it's not just about sharing technical information and resources, but also about showing the human side that is present in situations like this. But coming back to the question of resources that are being shared in the chat on the right side of the window, I'm going to share with you all the Facebook group that EASPD has set up to sort of keep the community connected in this uncertain period. There it is, the link. We share resources there, information, and sometimes just encouraging words to make sure that we keep on working and that we reach better circumstances soon. So throughout the webinar, we have received several questions from our participants. Maybe Fabrizio, we can go back to you with our first question, because a lot of people have been asking about people in institution and about the fact that we have to isolate people more and more. But what can we do to make sure that we maintain the mental health of persons who are being increasingly isolated, including people who might have challenging behavior or intellectual disability? Do you have any thoughts that you would like to share on this point?
Well, first of all, I cannot give you an experience about institutions, because finally we don't, let's say that we don't have any more kind of institutions that are still in other countries and where persons with intellectual disabilities are sheltered. So under that point of view, I think that we have to stay with them. We cannot do differently. We cannot leave them there, just give the key of the institute and go away and leave them by themselves. So we have to sacrifice ourselves. That's our part of our job, is our work. For the same reasons, like doctors are in the hospitals taking care of our coronavirus ill people, it's exactly the same. What we can try to do is, what I said before, is to have something on top of, to wear glasses, because it's urgent, you know, you don't have to touch your eyes as well. So glasses, because you never know what happens. Mask, as much as possible. Gloves, that's something that you can do in an institute. In a place as mine, that is not an institute, yes, Matilda, just 1 second, that is not an institute, is to say exactly, to do what we did before. They are not isolated, because we are always with them under a technological point of view. Thanking the technology we have today, in 2 days I have been able, as I said, to set up all the opportunities of the technological, both at homes of the people and together with us, with all the professionals, to know exactly what to do, and to take care. At least every day, my people is calling by phone everybody that they have to take care of, like they do in Scuola Viva, in my center, in my day center. Remember that I have a day center, as we have in Italy. Matilda, I think she wanted to say something.
Yes, if I can say something, one information that is very important is everybody has to follow the WHO guidelines. It has been also said by Alice and by Basilica. One thing that came out today is people that are already in multi-drugs treatment. So that is something that we have to keep in mind, because, for example, for fever, what it has been recommended is to use only paracetamol and not the other non-steroid anti-inflammatory. And this is something somebody might have missed. So my recommendation is also that for some information, you always try to have clear what is the health situation of people, which are the drugs, and maybe for those who are with intellectual disability who are under multi-drug treatment, having a written list of the drugs that they are already taking, because in case they need to get further treatment, it is important that everybody has a scheme, the medical scheme available to be provided maybe to other doctors and to other, and just to be sure that there are no interference between drugs. And as I said, the main recommendation that is coming today from the WHO is for fever, avoid anything that is not paracetamol. So please, for those of you who are already taking drugs, please have a list of the drugs that you take with the right dosage and the time in which you take it, and also have it with you so that people can, in a sense, share them with you. And in terms of further treatment, I mean, I'm working with the European Patient Forum, and what it is important to say is that although it is very risky disease and there are many people, the most fragile, that might have life-threatening risk, there are also many others who are doing this disease at home, and they can pass through it, and once they recover, although it is long and difficult, they come out of the disease. So we also have to say this, because it's certainly a high mortality disease and viral infection, but we're now seeing that if you follow the procedure, and if you keep distance, and if you keep the mask, if you wash your hands, and if you sniff in a proper way, there are also many people that get positivity to the virus and pass through the disease with positivity with the antibodies, so you pass through the virus and you pass through it. And there's also a good sign of hope that came out yesterday from some studies, that the very, very old people from China, but also from Italy, people above 94 and 97, they had the disease and they survived and they're recovering. So we have to also think that although it is not a flu, I mean, and I'm warning those countries, I read the comments, for some of the countries you're still thinking it is a flu. It is not a flu. It is much worse than a flu. Please follow what Fabrizio said, what Alice said, what Basilica said. It is not a flu. So the recommendations are not like a normal flu. However, many patients pass through it and recover. We also have to say this. So if you follow the instruction, if you protect yourself and your family and your guests and your people, then we will recover, I hope, the highest number we can.
Yeah, clear. Do we have more questions, Renaud, that should be tackled? Of course, we will try to reply to the questions that you see on the Q&A box. We will try to reply to these questions throughout the week, or organizing a follow-up webinar around these. But maybe you can take another question, Renaud, to be discussed by the panelists.
Yeah, Alice, maybe we don't have a lot of time left, but maybe could you address the specific needs or challenges encountered by persons with intellectual disability in such circumstances? Because we've been receiving a lot of questions about that.
Sorry, do you mean people with disability and behavioral problems, or challenging behavior, or mental health problems? Did you mean that? Mm-hmm. Yeah, because I did a little search last night in the main service providers in the Netherlands. Therefore, I raised that in my PowerPoint, that the daily routine of many people is disrupted. And that is what we all know as service providers, that is, for instance, that's happening in holidays as well. So most of the service providers have adapted already or have something in place for that. But next, on top of that, of course, there is specific problems or can be specific problems. And most important, what every service provider I talked to last night is suggesting is keep a daily routine. And that is very important, to have a daily routine if there is no daycare activities or whatsoever. And many support workers are very creative in having that. But of course, if you have one or two people with behavioral problems, or are having challenging behavior throughout the day, it's important to have, of course, some space. And space is the problem at the moment, because you are all together in the same spot. So it is important, I think, that that we share as much creative solutions that other colleagues have and are producing at the moment, because that is what I see. For instance, people with eating disorders, on top of all their other challenges already in life, they are very worried because of the stock in supermarkets, for instance. And it's important to know the specific needs of each of your clients to reassure them, because I saw in the chat that we don't need to panic, and I think that is very important. If we as professionals are panicking, then our clients feel that immediately, and therefore I found that such a strong, or is it upside down idea of that people with disabilities are reassuring us as a relatively healthy group, that they say we are facing problems throughout our life, don't panic. Let's face it and let's live by the day, but don't be stupid, of course.
Okay, thank you, Alice. I think we will all keep in mind the importance of mental health in situations like this. Fabrizio has asked to follow up, but maybe Fabrizio and Jessica, you could maybe give your sort of final key takeaway from today, just if you had one message that you would like to share as a conclusion with our participants. Okay, thank you, Renaud. Well, the only thing I would like to add, in a way, it has been already said by my colleagues. It's when Alice says to keep life exactly as much as possible close to the life, the daily life before the starting of this crisis, I totally agree. But in the same time, I would like to remember that there are things that we cannot do anymore, like just going out for having a nice walk together with our dog or together with a person and something like that. We have to stay home. So whatever we do, that's the reason why I established all the contacts with the video conference and so on, because it's not just a holiday. It's a period, strong, severe, hard. We have to stay home. We can go out for shopping. In Italy, we have a paper. We can go out for shopping, but we have to demonstrate to the police if they stop us. I can go out for health reasons, if I have to go to the doctor or to the hospital, or if I'm going to my work. So I have to fill this paper and give it to the police, because that's the only reasons why we can go out. It's not a joke. It's not something like, oh, that's nice. Today, it's here in Rome, today we have 26 degrees. But you have to remember, we are closing the parks, because it's not just a holiday. It's not going to Hyde Park for a picnic. We have to stay home, and we have to wash the hands and blah, blah, blah. You already heard it several times. Do it. Do it with your people. Do it in a nice way. Do it, find jokes, and we as providers, we keep close to our people. This is fundamental. That's my message is, don't leave them. Try to create and to establish the most interesting possibilities of having technology. We have it. It's not so difficult where it's possible.
Thank you very much, Fabrizio. Thank you.
On the end, only 1 minute, just about residential institutions and group homes that are different that in our country. We still have a residential institution for the people with profound and severe disability. So the measures are on higher, increased level of safety. So that is good. And the small group homes also. So I think that awareness, now people, professionals are very aware that they need attention. The people with disability need more attention now in this situation. So for now it is okay, but let's see how the situation will develop.
That's very hard. We don't know when it will finish.
Yeah. Yeah.
Okay. Thank you, Basilka. Thank you to all our speakers, to all the participants. I think we will wrap up the webinar now. I think we had some very interesting, very timely discussions today. As we said several times today, we intend at the EASPD to maintain these webinars every Wednesday at 2 p.m., at least while this current situation lasts. Next week, what we intend to cover is a topic more related to staffing, mental health, and communication. Also, on next Monday, RISE, an EASPD member from Israel, will host a webinar on the challenges caused by the virus for rehabilitation centers. We are going to share information on how to register to this webinar and to the other events via email today. We're also going to share with you a briefing note that we have drafted on the European response to the virus. And finally, we will share our Facebook group where we will try to collect all the links, all the resources and materials that you have shared with us today. And we are going to try to organize that and to make them available to the rest of our network. So I hope that this panel has been useful for you, and I hope that you will join us again next week. Thank you, our speakers. Thank you to the participants. Stay safe and goodbye.
Can I come in, Renaud?
Yes, Luke, please.
Very, very brief. First of all, I would like to thank Renaud for putting this together in such a short period of time. Of course, I also would like to thank the speakers. And Renaud already hinted about that. We are also working with the European Commission to make sure that also the European institutions take responsibility and do whatever they can to support our sector. As you might have seen in the news, the European Commission brought together 37 billion euro to look at the first needs related to this corona crisis. So we will make sure that also our sector can benefit from these European measures. And as said by Renaud, we will keep you informed and talk to you again next week during the next webinar or by our Facebook page. So you're not alone. EASPD tries to be with you during this crisis. Bye-bye, and thank you very much.
Goodbye.
Stay
Bye
home
to all.
and be
Bye.
safe.
Thank you.
Take care.
Ciao. Bye-bye.